Good evening, everybody who's just joining us on Zoom. And I'm sure that our development manager, Nina, will be letting more and more people in as we continue with this evening's event. As we'll discuss in a second, I'm Mr. Crumpton, the Director of Sixth Form Studies at Manchester High, and tonight's event is the Insight into Medicine. So we've got some fantastic guests this evening, and we thank everybody who's joined us on a cold and rainy Manchester evening. One of our guests is joining us from Abu Dhabi, as we were just discussing. There's rather different weather over there tonight. But again, thank you all very much. I'm very conscious because we've got 5 guests this evening that for time purposes, I'm gonna make a start. Obviously, there will be people joining us progressively over the course of the evening. I am Robert Crumpton. I am the new Director of Sixth Form Studies at Manchester High School for Girls. And I'm joined this evening by Mrs. Sarah Norton, who's the Head of Careers. And we are going to have hopefully a very insightful and interesting evening as we explore the experiences, both educationally and professionally, of 5 people in the medical sphere. So I'm actually going to make a pretty swift start with Zahir Ahmad, and hopefully we've got a slide about her that will be coming up. And there we go. Right, she's the former Manchester High pupil, the class of 2001, and she's currently a doctor and assistant clinical professor of medicine at Cleveland Clinic, which is in Abu Dhabi. So amazing for you to be here, Zahir. Thank you so much. Obviously, I've been reading up about all of you, and it's fantastic that you were able to do quite a lot of voluntary work when you were applying for medical school, weren't you? And actually, they asked you quite a lot about that while you were applying. Can you talk briefly about that?
Yeah, sure. Hi, everyone. Good evening. I'm joining you from halfway across the world. So we're in Abu Dhabi at the moment. So I'm glad the connection's working fine. So yeah, actually, during the interview process, the interviewers were so interested in some of the experience that I did. Now, I didn't have access to really traditional hospital GP work experience. I had some basic stuff, but I had to really think out of the box. What could I do? So, what's really important is anything that's in a really caring profession, a caring environment. That's what they want to see, that you kind of have an appreciation for putting other people's interests first. So I actually did some voluntary work for Bernardo's during my summer months, over 2 summers, and I was a sort of a caregiver for a boy. We used to take him to the summer school together, and I was sort of one-to-one care for him. And it was much easier back then to find these opportunities. I know there's a lot more hurdles now, but that was actually a really interesting point of discussion. And I'll tell you what was actually more fervently discussed than even voluntary work was my paid work. So since I turned 16 and I had my national insurance number, I started to work, and I worked in very unsalubrious places like McDonald's. I worked in a call center. I worked in Muji. And during the interview process, they were actually really interested to know kind of what I'd learned on those, because it was quite an unusual position to be in.
Yeah. So, sorry, go carry on.
The things like learning about responsibility, time management, interpersonal skills, and how I was demonstrating those in my work, how I was sort of independent and I gained confidence. And that's really what they want to kind of gauge, that do these potential students know these essential life skills that we don't always get in the conventional path. So I ended up actually getting, we could apply to 5 medical schools, and I ended up getting 5 offers. And I think the competencies that I was able to demonstrate actually really helped.
Yes, and that's fantastic. Thank you. And so you went to Cambridge initially. Is that right? I mean, how was that experience? I mean, obviously we've got quite a few people who are applying for Oxbridge, and it is a slightly more intensive process, isn't it?
That's right. It is, and it's not for everybody. So we had to do sort of more exams. The interviews were actually really quite demanding, and the prep for them as well was. But the reason I chose Cambridge in the end was because I actually really liked that traditional style of teaching, didactic based. I love the idea of focusing on specific sciences, your biochemistry, your physiology, your anatomy, in separate silos, and then kind of you have a great foundation to build on. They were the best years of my life. They were the hardest years of my life, but no regrets, really. The experience was fantastic. I really liked the idea of, in Cambridge and Oxford, you have tutorials, we call them supervisions. And so you'd finish all of your work for the day, so 5 p.m, and then you'd go back to your college, which is where you'd live and have all your friends and have your meals. And then you'd have a supervision afterwards between sort of 6 and 9 p.m. And it was small groups, and there was nowhere to hide. So in other universities, with large cohorts, and maybe people want to hide, but for us, it just really put a wind under our sails and made sure that we were kind of keeping up, and it gave us a fantastic foundation. It gave me, for me personally, a great competitive edge to go to Cambridge, and still, I'd say 20 years on, it's opening doors for me, not just because of the name, but because of the skills that I learned there. And it was a really great learning environment, and I would really recommend it. And I think for a lot of people who don't necessarily want to apply, or they're scared, it's really something internal. It's sort of imposter syndrome or a self-doubt that people have, that, okay, maybe it's not for me, but it's worth visiting, and it's worth talking to people who've been there, because it's an absolutely fantastic experience.
Oh yeah, I quite agree. As someone who went to Oxford, I think you're completely right. I think go for it if it's right for you. But then you went on to do, was it postgraduate work at the University of Manchester?
So the medicine at Cambridge back then was actually quite different. So you did your 3 years of preclinical medicine, and then everybody reapplied for clinical school. So about half the people tended to stay in Cambridge, about half the people went to London or Oxford universities, and there was a whole process. It was very easy, and everyone was guaranteed a place. And I started to think outside the box, and I thought, well, where do I want to work that reflects sort of the demographic that I want to practice my clinical medicine in, underserved communities, really multicultural place. And I didn't think I would get that staying in Cambridge, although fantastic place to live and study. So I sent, back then we used to write letters. I sent a letter to the dean at Manchester Medical School, and I said, this is my situation. Would you take me for an interview? Because of course they take the St. Andrews students, and it's a very similar background. So, and they did, and they brought me in for an interview, and I got a place. So then I moved, and I did my last 3 years of medicine, my medical degree, actually at University of.
And how was that different? I mean, would you recommend to someone from Manchester? Obviously, we do have quite a lot of students who would like to continue staying in Manchester, sometimes even staying at home. And Manchester University obviously does have an excellent medical school. So, how was it different from being at Cambridge?
Yeah, do you know, the difference was stark. I mean, immediately, sort of when I landed, it was a much less stressful environment. It was a much less competitive environment. There was actually a much more sort of focus on holistic sort of growth through university, and a big focus on extracurricular activities. Remember, Wednesday afternoons, everyone was just off uni and they were doing extracurriculars, which there wasn't quite a focus on at Cambridge, just because the academics were so sort of intense. It was, okay, if you didn't pass or you didn't fail, you just reset. Yeah, it was just a very comfortable, welcoming environment, and I'm glad I got the best of both worlds. I do have a preference, but I would say think about sort of what career goals you have, what personal values you have, and then pick your university sort of based on those.
And then, of course, you've gone on to do so many fascinating postgraduate diplomas in, public health, medical education, child health. I mean, it's incredible, to be honest, that you've continued with the, with the study bug, basically. And obviously, one of the areas that you have moved into is medical recruitment and leadership. Is that something that you could talk to us about?
Yeah, so when I was doing my GP training, we have the opportunity of doing fellowships when you're doing training, which extends your training usually by a year, but actually you get to do some really formal education and training whilst you're at it. So I applied for something called the Medical Leadership Program, which was there to sort of cultivate the sort of NHS leaders of the future. And so what I did was a master's at Manchester Business School and University of Manchester in medical leadership. And it was an immense a period of sort of personal growth for me and experience. And on the back of those, actually, it opened up so many doors for me. So during my training then, I was elected chair of the RCGP training committee, which oversaw sort of the training of 11,000 GP trainees, so the largest cohort of trainee doctors. And that was a huge achievement at the time, first female, to be in that role. And it allowed me to actually put some of the skills that I'd learned into impact. Part of that, I was invited to number 10 to talk about the issues with sort of GP recruitment and how we can recruit more people into our sort of profession. But medicine really lends itself to whatever signature strength you have, whether it's a sort of a penchant for leadership or medical education or just pure clinical work. That's the beauty of medicine that I find. You can really craft your job to suit your strengths.
Yes, I think that's really clear from the range of guests that we have this evening. I mean, underselling a little bit being invited to number 10, I think that's pretty impressive, and also similarly impressive that you were voted Physician of the Year in 2013. Can you tell us a bit about that award, which again is fantastically impressive?
Yeah, thank you. I mean, it was a little bit sooner than that. It was this year, 2023.
Oh,
but
really? Okay, I'm sorry, apologies. I'm misreading. Oh wow. So yes, how did that happen? And this is in a sort of international context, with the hospital in Abu Dhabi, isn't it?
Yeah, so in 2014, that's when I moved to Abu Dhabi, and it was a little bit tough because I had just I was riding the crest of a wave in England, and I had sort of built networks, and I had some roles that I really felt like I was giving back, and then suddenly the rug's pulled from under you, and my husband got a job abroad, and so we had to move, and we got to leave that and figure out, am I gonna, get down about kind of having to start looking, or am I going to just pull my socks up and just, understand that I've got some key skills that I've learned and apply them. And so I got a job at Cleveland Clinic Abu Dhabi, which is sort of a branch of Cleveland Clinic from Ohio. And we work in a large hospital, and I started from the ground up, and I had to sort of build my skills for this demographic of patients. I had to build my network, my sort of abilities, and then it culminated actually this year in being voted Physician of the Year, which was fairly humbling because it was voted for by physicians. But there was a couple of things that were interesting about it. Number one, I was like, really, that imposter syndrome was really kind of rearing its head, and because we have people who cure cancer and who do life-saving surgeries, and a GP, are you sure? But I zipped my mouth and I took it. But it was great for recognition of sort of family physicians and the important role that we play in the general healthcare system.
And so currently, at the Cleveland Clinic, you spend about 50% of the time as a family GP, and then 50% of the time training junior doctors. I mean, again, how does that balance itself out? Occasionally, could you give us maybe an idea about what your day looks like?
Yeah, sure. So usually in the mornings I'm in clinic. We see about 12 patients every morning. We have 20-minute appointments for patients, and we see the whole variety of things. This morning I saw someone who'd lifted something, popped a hernia, had to get into surgery. We saw a girl with sort of really brittle asthma who we had to get to the emergency department. And then I saw a fantastic, a chap who had started on this revolutionary weight loss drug, and he'd lost like 40 kilos in weight just in the last few months. So a whole host of variety of sort of clinical cases. And that's the great thing about general practice, is that you really see the whole remit of presentations. And that's why, it suits me so well. And then usually then in the afternoons, I'm working with our junior doctors more in a strategic way. So thinking about, how do we develop curricula? How do I help struggling learners? How do I give feedback, mentorship? A lot about recruitment, so interviewing and recruitment into the program. So a good balance that works for me.
No, fantastic. I think that with that work-life balance as well is something so important, something that hopefully lots of us will be able to talk about. I'm again just conscious of sort of moving forwards. I mean, you've mentioned imposter syndrome. Is that something that you still feel? Is there any sort of tips or hints you could give to particularly the young women who are on this event, who might feel imposter syndrome and in many cases really shouldn't?
Yeah, it definitely still affects me, and I tell you, it affects the majority of people, so there was a great book called Good to Great, which looked at the Fortune 500 companies, and the majority of the CEOs of these amazing companies faced imposter syndrome. So I'd say you're not alone if you feel it. But what is important is to recognize it and recognize the symptoms, have a great group of people around you who are like, you know, you're being an imposter right now. So, and so once you recognize the sort of signs and symptoms of it, you can then completely control it. And I don't think it ever goes away. It actually just befriends you, really.
Excellent. Just we've got a question. I just will say to everybody now, apologies, I should have done this at the start. You can put questions in the chat. That we will be able to answer most questions towards the end of the session. If one comes up that I think is specifically significant at that moment, I'll ask it. And I'll ask one of these now. Did you have to do any additional training in order to work abroad? Was there quite easy to validate, as we might say, to be able to go and work in Abu Dhabi?
Yeah, great question. I didn't actually. And in a lot of places, so say Australia and the UAE, the Middle East, you don't have to. If you have CCT, which is your completion of training as a consultant from the UK or the US, you don't actually have to do any exams. You just have to provide all of your evidences and your license, and that's it. So that's it makes it easier for people to leave.
Yes, which is maybe the NHS would like that to be different, possibly. But just suppose it just speaks to how impressive our medical training is here in the UK. I suppose a final question. This is something I will be asking everybody, really. Are there any significant tips you would give to people who are thinking of applying for medical school, and perhaps particularly for Oxbridge? You talked about the volunteering, about the paid work. Actually, anything else that you think you would recommend as something which is really important they should be doing?
Yeah, I think what's important is what you want to demonstrate is that you can withstand the vigor of a 5 or 6 year medical degree, and then you have the stamina and the endurance to keep going as long as the rest of us have, and because it takes a lot of perseverance. And so when you're approaching interviews and your personal statements, what you want to talk about is, how you manage, your well-being, how resilient you are, and how you can demonstrate that. I would probably go to an interview now if I was to go back and say, look, I looked at the NHS beating burnout toolkit, and I was able to apply that to myself, and actually found it really useful. And in fact, you could even improve it by this, and this, and so you're actually taking something and creating something beyond it. That's one thing. And I think another thing is actually just getting really comfortable with feedback, receiving feedback, because undergraduate and postgraduate medicine is all about a cycle of feedback and reflection, improvement, feedback, reflection, and improvement, and seeing feedback for what it is, which is just an opportunity for you to grow, especially that constructive feedback. And the people who actually progress much further and faster in their careers are those people who internalize feedback and think, great, this is how I'm going to improve.
That's brilliant. I'm literally writing that down now. That's fantastic. Thank you so much. Again, we will be asking questions as we move towards the end of the evening. That's so insightful, so fascinating. And we're just going to be moving on now to our next guest. So this is Harindi Alawatagama, and she's the class of 2013. She's actually joining us now, I think, from the hospital. There she is. So thank you so much for giving us your time this evening.
Yep.
And you're currently working in vascular surgery higher training, which is amazing. And you were at Manchester High from year 5 all the way to A levels, weren't you? Now, you did biology, chemistry, and history as your 3 A levels that you took all the way through. I mean, do you think it's important to have, obviously, lots of medical schools will say either biology, and/or chemistry? Do you think they were the right A levels for you, as a doctor now, looking back?
Yeah, I mean, medical schools always ask for chemistry plus minus biology, and I think realistically, if you're planning on doing a career in medicine looking at humans, I would advise biology probably would be helpful. I mean, I remember my first med school lecture, and I'm pretty sure it summed up the whole 2 years of A level in like an hour, which I was completely shocked by, but it at least made one of those lectures for the next you know, 2 years, a little bit more familiar. And I chose history, which is an odd combination because a lot of my sort of friends that also applied for medicine sort of stuck to sciences and maths, or, you know, things like that. But do you know what? It just sums me up. And I think, though, looking back even now, I think those A levels basically summarize or represent the kind of person I am, which is, yes, I'm into my sciences, but actually I enjoy reading. I enjoy looking back at other things. I have interests outside of just sort of the sciences and things like that. And I just really enjoy it. And you know, I had great teachers, and I just didn't really want to give that up. And to be fair, that I do remember the university I actually really wanted to go to when I was applying was UCL. And they had, at the time, I don't know if it's changed, but they did have a preference for students that had that sort of well-balanced nature. They had, you know, like a humanities subject. They were known to have a preference for those. So it might be worth sort of looking into the prospectuses a bit more to see if that kind of subject diversity is there for places you want to go.
No, that's true. I mean, they've really continued that. I mean, they've got a relatively new course, which is, you know, arts and sciences. It's, you know,
Right.
SC. So, you know, they literally, you know, where you have a kind of major minor pathway. So, no, I mean, that's I think that's still the case in many ways. But in the end, you went to the University of Birmingham.
I did.
And, you know, graduated in 2018, which meant that, so you didn't do that kind of the, you know, the intercalation year, you know, where, you know, you can, you know, to get the BSc. Can you explain that to people? Because not everyone will know exactly what that is.
Yeah, so there are some universities like Oxbridge, UCL, Imperial, and I think Nottingham might have added a couple more by then. But those are the sort of main ones that I knew when I was applying. Where you, at the end of 6 years, you get both your medical degree and sort of an added year of a BSc year, which is basically a year spent doing a bit of research and doing a dissertation. You get a bit of a flavour for research and sort of writing up sort of formal academic pieces of work. And a lot of people, even if you've gone for a 5-year degree, do have this option to intercalate. And that's basically to do a BSc, or actually now it's probably spread to other sort of degrees that to do with like humanities and things, where you can take a year out and do a bit of research, do a bit of arts, humanities, something else that's your interest. Or if you have already an idea in mind about what you might want to specialize in, maybe direct that intercalated degree towards that. And it basically gives you 2 degrees at the end of it. Takes a year, but it gives you two degrees. I was a bit on the fence about it, mainly because I know a lot of people that had done it, and then equally a lot of people that hadn't done it. And there was I think at the time I was doing it, I don't think it's relevant anymore, but they used to give you 1 extra point when you applied foundation program at the end of your 5 years of med school, and it used to give you 1 extra degree point. I don't think that counts anymore, to be honest. But thinking sort of how far I didn't do it in the end, I don't think it's massively detrimented me either. I still do research now. Whether it would have helped, whether it would have given me an extra year of enjoying university life, maybe, I don't know. But I think if you're interested and you have a project in an area that you want to do it in, absolutely go for it. But it's also not mandatory. It's not compulsory. It won't sort of affect your career if you don't do it. That's what I would say.
And obviously, in the end, you did realise what your real interest was in your 3rd year, wasn't it? Which was in the sort of general surgery placement that you had as and that was your first clinical placement, wasn't it? And that has basically changed your life subsequently. You know, can you tell us a bit about that process of, you know, why surgery suddenly seemed you know, the most, you know, attractive and exciting part of the, you know, clinical practice?
So to be honest, when I applied for med school in the first sort of 2 years of medical school, I had no idea what I wanted to do. I'm not entirely sure that I knew 100% what I was getting myself in for when I applied for med school, just that I liked biology and chemistry and bits and bobs. And then we got a flavor in 3rd year of med school, which is the same as most other med schools. You start clinical placement. So you start going in and being on wards, seeing outpatient clinics. If you're lucky, you get to go to theatre, and it's just all about learning, doing little skills, speaking to patients, understanding sort of how conditions work, management, things like that. And I started this general surgery patient. It was actually upper GI. And to be very honest, there was a surgical registrar there. She was this 5-foot female registrar that was an absolute sort of boss. She was so friendly, so like great with the patients. And then just to be honest, what I really liked about surgery was one, it was fast paced, so things happen very quickly. And for some, that's not for everyone, but for me, I'm fairly efficient, I'm organized, and I like the sort of constant change that you have. And the one thing I would say about surgery is it's really nice to feel like you can actually fix a problem. There's a lot of things in medicine, unfortunately, it's just the nature of it, where you try and you try and you try, and things don't necessarily always get better. But, someone comes in with, they've got gallstones, are having pain after, eating foods, it's causing them a lot of discomfort. And then you offer them an operation, you remove the gallbladder, and that's it. That's, you never see them again. And it's made a significant impact on their quality of life. So I really like that. And there's a huge variety in surgery, and it's not for everyone. I know a lot of people that don't like it, but it was a really natural fit for me. And I think as soon as I did that placement, I just knew I loved it.
Oh, good. Well, that's fantastic. Obviously, as you say, there are lots of different things that you can be doing, and of course, everyone has to do them, don't they? I mean, I think you were down in the West Midlands still for your foundation training. Doing everything from respiratory medicine, renal medicine, to trauma. I mean, again, what is it like with that? Quite significant overview of everything, but churning through all these different aspects of medical training.
Yeah. So. To be honest, medical training generally is a rotational basis. So whatever training program you do, I know so I was talking about GP training. She would have rotated through multiple different specialties, and there's good points and bad points to that. The bad points are obviously you're constantly you're rotating hospitals, you're rotating departments. You might have to commute to quite far places. You might have to physically move, like I've had to do. And those are all sort of challenges of life affecting sort of your day-to-day life. But in terms of sort of the specialties you rotate through, as much as I'm a surgeon through and through, I have a massive appreciation for all the other specialties. And, medicine and the NHS wouldn't function without us all working together. And I think there's a big benefit of not just knowing your own specialty. Yes, you have to work with you're constantly working with other sort of specialties to get sort of the right outcome for your patients. But it's good to have an appreciation and at least a basic understanding of what patients might need. It means that they have an overall better patient care because you know what they need, even though you're going to refer them to a specialist in that area. So I think it actually makes you a much well-rounded doctor if you do rotate and you get this flavor of, medical specialties, surgical specialties, psychiatry, GP. I did a GP job as a foundation doctor, and honestly, it was a great. Probably the most appreciation I've ever got from patients was in my GP job. But
well, they weren't anesthetic, Corindy, so. Yeah. So and then you moved back to Manchester for a bit, didn't you? I think you were in was it in Salford Royal for a time?
Yeah. So I did a what we call a year out of training. So most sort of training posts are sort of directed towards a specific sort of training pathway. So right now I'm a vascular trainee, so I'm working towards being a vascular consultant. But you can do these years out, which has become much more flexible in the last couple of years compared to maybe 15, 20 years ago when you couldn't really do that, where you can take a pause from sort of training and doing all the portfolio and the grind of constantly having assessments and things done and have a bit of a free year. I happened to unfortunately coincided with COVID that year. So I didn't get to do all my traveling plans, which was what I wanted to do and have a bit of a break. But actually, yeah, it had good points and bad points. I'm sure you're about to ask me about COVID.
You already know me so well. Yeah, I mean, obviously, COVID, I'm sure affected everybody's lives and careers. I mean, can you give us sort of an overview about what it was like to be, a junior doctor in the NHS when COVID hit?
Yeah, so I was an F2, so foundation, second year of being a doctor, and then COVID sort of struck. The first wave was actually fantastic because there wasn't a whole lot. It was actually very calm in hospitals because no one came into hospitals, and we didn't have a whole lot of workload, if you like, because we weren't. It was all very uncertain, and it was a bit strange. But probably the worst was that winter that came in 2020. And that's when I was actually working at Salford Royal in my sort of non-training year. I was working in ENT surgery, ear, nose and throat. So that is a specialty that normally has really good outcomes. You don't have a lot of patients that, die or have very bad outcomes because it's a fairly young population you tend to get in ENT surgery. And unfortunately, the amount, I saw a lot of death in my first year as a doctor, but the challenges I think with COVID was one associated with the fact that you already had a tired but slightly burnt out NHS workforce, and they just had to pull their socks up and just cope with sort of COVID and the onslaught of like huge numbers of patients, huge numbers of sort of patients that shouldn't really be ill, but they suddenly were. A lot of patients died and we couldn't do anything about it. There'd be patients that were dying without, their family, close ones around them. And that was quite difficult to deal with as well. And then, the other thing is for us as NHS workers, I wasn't seeing my parents, I wasn't seeing my family or friends. We were being quite sort of distant because I didn't know the risks I would have. Yeah. You and sort of Dettol wiping all your bags and things like that. It was, I think overall, it was very challenging, sort of probably year and a half, 2 years, led to a lot of burnout and, post COVID, it's been a real sort of struggle to get everyone sort of back up into morale levels. And I suppose it's not really helped that things are sort of still carrying on a little bit. Yeah. But I'm very proud of, my team that I worked with and, just generally doctors and nurses and all the allied health professions and the NHS for sort of doing quite so well in sort of unimaginable times, really.
No, well, I extend the appreciation of everybody who's on this Zoom, to be honest, for you and for all our guests, because I think we owe you such a debt, and and I hope that will somehow be paid off, maybe by the government coming to terms at some point. Just really to ask really the last question. You mentioned it briefly, but I really think again, it's time to blow the trumpets of our fantastic guests, because you did apply for the vascular surgery registrar post. You got onto that at the first attempt, and you were ranking 11th in the entire country, and you're basically the youngest person who's in that position. That's hugely impressive. Can you just tell us a final sort of roundup, really, how that came about and how you're finding it? Because I think you just started that job like last week. Yeah, wow. Okay. So yeah. Please tell us more.
It's I'm going to touch back on this term, imposter syndrome. It's very active. It's, to be honest, I think I've surprised myself as how well I've managed to do, just because I was always someone that worked very hard, especially if there was something I wanted. Imposter syndrome is one thing, but you can always have sort of belief in yourself that you'll achieve something. So I never doubted that I would get to where I was. It was just I wasn't quite sure about whether I'd have to try a lot harder, because in terms of like doing multiple years, multiple applications. I know it's not easy to get into training programs these days at higher sort of specialty levels, depending on the specialty, because there just isn't that many jobs funded anymore. So you have smaller and smaller numbers. And in the Northwest, actually, there wasn't a single vascular registrar post, which is why I've sort of moved out again. And yeah, it's quite daunting being surrounded by people that are meant to be at your level, but that are that are older than you, that have kids, you know, and they've done a lot more work in the specialty you're doing, so they're a lot more experienced than I am at this point. But at the same time, I think I do, you know, swallow down my imposter syndrome on a daily basis to just try and, like, you know, tell myself that, you know what, you wouldn't have got to the position you have if you you know, you've gone through a fairly rigorous application process. So you've just got to believe in yourself and just try very hard not to compare yourself to the people around you, and just keep working hard, and then, you know, rewards will hopefully come.
Yeah, absolutely. A phrase that, you know, we do like to use at Manchester High is, you know, comparison is the thief of joy, and I think that's something that we can all remember and try and apply.
A philosophy I learned. This whole mentality I have is probably born at Manchester High, to be honest. It's got me very far.
Oh, well, thank you so much, Harinder. That's, you know, really fantastic, and particularly as we can see, you know, you've got the medical whiteboard behind you. I mean, you know, so much appreciated. I'm going to move on though, but please, you know, stay with us as long as you can for questions at the end. And I remind people that you can put questions in the chat, you know, specifically for Harinder or to be answered by all of our guests. So I'm going to move on to Mamoona Khalid Raja. Now, she is a friend of Manchester High, and she is an ENT surgeon at Stepping Hill Hospital in Stockport. And it's, you know, wonderful to have her here. She's a parent of a pupil here at Manchester High. And I'd love to ask her again, although, you know, you know, yourself didn't go to Manchester High, but you again did focus very much on the sciences. So, you know, biology, chemistry, physics, and maths. So you're doing four A levels. I mean, was that a challenge to be able to do the four A levels? Do you think that was an advantage when you came to apply for medicine?
So that was just the norm for me, because I just thought, well, I'll do four A levels. I think it was mainly because I knew medicine was competitive, and I didn't have the advantage of lots of extracurricular activities and things like that. So I needed to give myself the edge. And so academically, I thought this is the way to do it. And I did, it sounds really sad, but I really struggled if I had to decide on which three I would decide on. So I went to an independent girls' school, and I was one of four siblings. We all went to private school, and it was a little bit of a struggle for my parents. And so extracurricular activities had a price attached to them, and so it was the academia that then I had to focus on.
And in terms of the application process, I mean, did you do quite a lot of work experience? Was that something which was necessary for a medical application? And what kind of work experience did you do?
I spent some time doing some work experience in our local hospital. And other than that, I was helping with the family business. And actually, I think that was in my favor. So I'd done it for summer holidays before my, GCSE. As soon as I was able to, I was helping in the family business. And so I think that was something that gave me a point to talk about in my interview. And then, of course, the work experience that I'd done in the hospital and within a GP practice as well.
That's great. Well, I think that's interesting, isn't it? You know, the hospital and GP practice. But again, you know, so it really echoes what Seha was telling us about, about how interesting it is to have, paid work and sort of demonstrate some of those other skills, not necessarily in a medical setting. When you applied, I think you wanted to sort of stay close to home, and in the end, you went to Sheffield University to study medicine, didn't you? Can you tell us a bit about the application, but then moving on to tell us about what it was like to study in Sheffield?
Yes. So for the application, so I applied to the universities that were kind of close by and completed my UCAS form as normal. I was invited to an interview in Sheffield, and I was given a conditional offer. The interview itself, this is a long time ago, but there's a few things that will always stay in my mind. I remember being asked, and it was quite a long conversation about some latest medical innovation that I'd read about in a journal. It went into quite a lot of depth.
So that's key for everyone. I think anything that you mention in your personal statement, be prepared to talk about it potentially at length. So I think that's a message for everyone. But sorry, please carry on, Ramona.
So Sheffield had quite a traditional medical degree. So we did a lot of lab-based kind of dissection, physiology, and kind of practical sessions, and combined with the theory lectures. And so that was the first 3 years. And then I decided that I wanted to intercalate. It was an option, and I guess the reason that I did that was because I realized that even once you kind of, every stage there's a hurdle. So getting into med school is a hurdle. And in order to try and get yourself to excel and stand out, you've got to have something. And so then I realized that even then, going on to do my foundation training, I need something. So I decided I would intercalate, and I looked at the options, and I thought, I'm going to do something slightly different and move from Sheffield and go to London. So I went through an interview process, King's College, Imperial, and UCL, and I got offered a place at all three. So it was fairly straightforward. I decided I'd go to Imperial for a year, and that was a great experience for me, living the life in London and doing my intercalated BSc, which was in pharmacology and toxicology. So I was at the South Kensington campus, and some of the lab work was a little bit dry, looking at NMR spectroscopy, but actually I learned so much about literature searches, critically analysing journal papers, and being able to do kind of lab work and writing up a dissertation independently, which was something that I hadn't done before. I had the guidance there, but it was just working on my own. And so that was a really good year. And then I went back to Sheffield for my clinical years.
And then you moved into foundation training, staying in South Yorkshire. And then I think one of your first jobs was in ear, nose and throat, wasn't it? And why did you then ultimately start to gravitate towards that?
So I always liked head and neck anatomy. I was always kind of, drawn by that. And then when I did it was actually my first posting was in ear, nose and throat. And someone had said to me, always look at the job of the consultant, because that's what you're going to spend 20 plus years of your life doing, not the training, not the SHO or the registrar, it's the consultant. And that's the lifestyle that you want to look at and see, is this something I can do for so long? And I guess what I liked about ear, nose and throat was that you have a lot of outpatient work. You will have some inpatient, a little bit like what Harindi was saying. You have a range of patients. The majority of your patients will be, within of good health, and they will have, quality of life issues. And then you've got a small group of patients who will go to the other extreme, where they come in with an airway emergency, and that's the adrenaline rush, and you've got to do something quick, or they're bleeding or something. So you've got a vast range there. You deal with adults, children, babies, and there are some things which are medically managed, and there are some things which you and then you operate. And I liked the variation within your day. So you could spend half your time operating and half your time in clinic and doing other things.
You got married during that foundation training year, didn't you? And again, so being personal really, but I think it's really important, particularly as women, in any profession, but perhaps particularly within medicine, is that then you when you got pregnant. What fears did you have? Because I think it's a sort of challenging period, isn't it? Particularly maybe in the early career, and how has that sort of worked itself out?
Yeah, so I was a core trainee when I got pregnant, and so I hadn't actually got the registrar number, and it was actually a point where the training was going through a lot of change. We had this new ISCP portfolio which had come in. The training, they were trying to make it more kind of streamline. And again, there was a lot of competition. And I remember just people saying to me, oh my goodness, you know, you are not going to have the support of so-and-so consultant. You know, there was a trainee who, you know, was similar to you. She'd got pregnant. She then wanted to go less than full time, and she didn't actually complete her training. And so because of that, in the shadows, you know, you're not going to get the support. And actually it was the opposite. I remember at my interview, someone saying to me, so for my registrar, for my specialty training interview, someone said to me, that one of the interview panelists, oh, there's a gap in your CV here. And as soon as I said, oh, I was on maternity leave, she just wanted to brush over that as quick as possible, did not want to make that an issue at all. She said, oh, no, yeah, that's fine, you know, so it was fine. I've not had any obstacles other, you know, than, you know, I wouldn't even say that was an obstacle. It was more of a kind of fear that was not necessary, really.
Oh, I think that's like really great, you know, to try and you know, dissolve some of those fears. I mean, obviously, I suppose it is a balancing act, isn't it? Because I mean, I should say, you know, Harindi's, you know, at hospital. I mean, you've got an 8-month-old, you know, at home at the moment, haven't you? I mean, is it you know, is it still a balancing act as you're moving into, you know, being a consultant and having, you know, 3 children? Obviously, this is you know, a challenge, but presumably a really fulfilling one.
It is. It's definitely a challenge. But you know, I think you just kind of get on with it. There are some things which having a supportive partner, you know, so like Harindi was saying, there are so many points where you kind of have to rotate from one place to another. And having got married when I was a foundation trainee, my husband had to actually resign from jobs. And then I did a year abroad, and he spent half of that not working and half of it doing voluntary work. So, you know, you kind of really do need that support from your partner, and any other help from family, parents, in-laws, whatever, you know, is very, very welcome. And, you know, I think it's just being organized. And, you know, if you're content with your home life, your family life, then, you know, you can work, you know, you don't have that stress, you know, that you would. So you kind of need that reassurance that everything's fine at home. And I mean, parent guilt always happens. You know, you always think, oh, I didn't do this. You know, I've sent my children to school in their uniform on a non-uniform day, you know, and things like that. And, you know, you just get on with it, and it's you that feels it more than the child. So.
And I'm just going to talk a bit more about your current job at Stepping Hill. But just before then, can you tell us quite briefly about what it was like to do a fellowship over in Canada, in Nova Scotia, in Halifax? Again, how does one get the opportunity to do those fellowships? And what was it like?
Yeah. So I did my specialty training in West Midlands, and pretty much, you know, you do your specialty training, and then you are kind of called a day one consultant, and more, you know, trainees or doctors are now doing a fellowship, which is kind of a year of subspecialty training. So, for example, if I'm an ENT surgeon, within ENT you can subspecialize. So you can do kind of, you know, more ears, or more rhinology, or, you know, more head and neck surgery. And in order to kind of bridge that gap between a trainee and a consultant, you can do like a fellowship year, and you can do them within the UK, or you can do them abroad. So I applied for it's called a TWJ fellowship, and you go through an interview process with the Royal College, so I had that opportunity, and it was great. You know, the whole family, we all went. It was a holiday. It was a year of holiday for them, and a year of intense work for me. So, but it was very enjoyable. It was great to see how they kind of practice medicine or ENT surgery in a different country. And you actually, it opens your eyes. You realize what's done well here and how we could improve and things like that. So it was a really good opportunity.
Fantastic. And just very briefly then, before we do have to move on, could you give us a flavour of what a day in your life is like at Stepping Hill? You know, sort of, and take us through, you know, how, you know, what kind of tasks you have, what kind of, you know, teamwork you're doing. You know, I think that would be really fascinating.
Yeah, sure. So if I take my Mondays, I normally have a clinic in the morning. The clinic is usually can be some new patients, as well as head and neck cancer patients who've had treatment, who are now going through a surveillance period to check to make sure that everything's okay, in that they haven't developed any other cancers, and they're not struggling too much with the side effects of the treatment that they've had. And so that's my morning clinic. It's usually a multidisciplinary, which means that I usually have somebody with me, so an allied nurse professional, as well as we have speech therapists. So it's quite nice because you're addressing the patient's concerns from different angles, as more of a holistic view as well. And then at lunchtime, it's a working lunch. We have the skin multidisciplinary meeting, which is usually on Teams, and we discuss new skin cancer cases. And then in the afternoon, I'm in the operating theatre doing skin cancer surgery from the nose or the ear.
Wow, what a day! I'm exhausted just hearing it, and you know, so impressive. Thank you so much, Marina. That's really, you know, a wonderful insight into, you know, into a really, you know, varied and an interesting career, both educationally and professionally. So we are going to move on to Anne Foster now, who's another friend of Manchester High. She is a consultant paediatric orthopaedic surgeon, and she's also the associate medical director of Spire Healthcare. And you know, you're not a Mancunian, Anne, are you? From North Wales, and not from a medical background yourself. Perhaps you could sort of just take us through, you know, your educational journey and what led you to ultimately applying for and studying medicine.
Sure, yeah. Evening, everyone. Can you hear me okay?
Yep.
Yeah, so as you say, I came to Manchester for med school and kind of have never left. But yeah, prior to that, my background was, I was the youngest of 3 girls, and every single person in my family was a teacher. So the one thing I was never going to be was a teacher. And actually, when I was a child, I always wanted to be a vet, partly because my complete love of animals. I have 2 dogs now. And also we lived next door to the local vet, who was the loveliest man. I was kind of in awe of this guy. And at school, I would love sciences, and so I just went to my local comprehensive school, as it was then, did my GCSEs, and then went to sixth form college, because we didn't have a sixth form in school. And I still, at that point, as I went into my sixth form, I was still planning on being a vet. I did biology, chemistry, physics were my choices for my A-levels. And it was actually when I was in what we used to call lower 6, which is year 12 now, that I met a friend, actually, a young guy, and he was the son of a doctor, and he was planning on doing medicine. And this is the first time that it even entered my mind of doing medicine. And I went on work experience both to a veterinary hospital and to a human hospital. And it was my experience there that made me think about doing medicine, actually. And that amazing, I remember, I mean, this wouldn't happen now. I went on work experience and I saw a baby being born, and I was just completely overwhelmed by that experience. And it made me, the connection that you have. Animals are amazing too, don't get me wrong, but that human to human connection, it was just amazing for me. And it was because of that I chose to do medicine. And I mean, it was very different. We're going back quite a long way here, and the whole kind of application process was probably very different from how it is now. In fact, Manchester did not interview at the time. Everyone else did interview. I got 5 offers for following interview, and Manchester did not interview. In fact, they had an open day, and I remember on the open day, they took us around the anatomy dissection room, and again, it was the experience of doing that, not thinking, of course, that obviously have a dissection room in every university, but it was that I just thought, wow, that's me. So a lot of my big life decisions have been made on quite serendipitous, spur of the moment events like that, really. And then I found myself in Manchester, fairly kind of standards, kind of 2 years preclinical, 3 years clinical medicine, very kind of old school kind of course there, really.
And then what is the trajectory from that, relatively traditional structure, at Manchester to ending up, at the, you've got a sort of lovely rule of three job title, sort of like, so consultant, pediatric, orthopedic. How do we get those three in that order?
Yeah, I don't do everything in threes. Yeah, so I mean, I knew very early on at med school, I was always that I was probably more surgical than medical. And I think once you start doing clinical medicine, you just get a feeling. And as everyone else has said, there is absolutely something for everyone in medicine, depending on what makes you tick and what kind of person you are. I remember now the first time I went into theatre with my clinical partner, and we walked in, and there was some bowel surgery. I could see this peristaltic bowel, and I was just, again, I had that moment. I just thought, this kind of epiphany moment. And then I heard this thud as my clinical partner collapsed and was literally dragged out of the theatre. So it became very obvious at that moment, we were going to head in different directions. She's an amazing GP now, and I am here. And so every point after that, I was always very interested in surgery. As people have said, what we called it basic surgical training back then, but similar. I think they've just renamed it, to be fair, just kind of rotational through different surgical specialties. I love general surgery. I did a lot of general surgery, but for me, I chose orthopedics. A very, very visual specialty. We talk about fixing people. I know that sounds really basic, but really, you literally do that. You put trauma patients back together, and it's incredibly rewarding. Not a lot of nasty bodily fluids in orthopedics as well. And I mean, I did a lot with, it's a nice clean specialty. I've always felt very at home in orthopedics.
Sorry, just for people who might be joining us who aren't quite sure exactly what orthopedics comprises, could you just do a bit of an overview about what that, I think some things are sort of self-explanatory, but
yeah, sure. So, I mean, orthopedics is essentially the surgical management of musculoskeletal problems. So anything to do with your bones and your muscles that requires a surgical intervention, really. But even within that, there's lots of subspecialties. So orthopedic surgeons, they deal with kind of adult orthopedic surgeons would be very joint specific. So you have knee surgeons, hip surgeons, hand surgeons, lots of super specialized areas within that. And most orthopedic surgeons, as well as having their kind of subspecialty interest or thing that they do, they deal with trauma as well, which is a more generic. So the emergency cases that come in, so major trauma, minor trauma, all that kind of thing as well. So it's hugely varied.
And do you have to be on call still as a surgeon? I mean, would you, and how often, would you as a consultant have to be sort of, brought into A&E for a particular case?
Yeah. So, I mean, on call is part of any doctor's life. From the minute you graduate, you do, it's a 24-hour service for anyone, and there's different ways you work your emergency work. I've always done a traditional on-call system that you describe. People do, that has changed slightly now, so that people do kind of work in different ways, but I've always worked an on-call system. I actually don't now. I've been a consultant nearly 16 years, and I'm not on the on-call rota anymore, but for literally 25 years I have been. But it becomes a normal part of your life. You have to be very good at getting out of bed very quickly and up and out, because when you're covering a major trauma service, which we do at the Children's Hospital, you have to get up, go out and operate. So like I say, you've got to be good at doing that. It gets harder as you get older, but when you're young, it's fine. You bounce back pretty quickly, but it just becomes a very normal part of your life. Yeah.
Sure. When you obviously touched on there the fact that you were at Manchester Children's Hospital, and and as somebody who works in paediatrics and deals with major trauma, I mean, I suppose, and I suppose this is just a general point about how one copes with the emotional aspects and consequences of medicine, and particularly in a trauma setting, and particularly in a traumatic setting with children involved. I mean, how does one deal with that? I mean, it links back to what Harindi was saying, about dealing with COVID as well. Are there strategies? Is there support when you're studying and when you're working to help you deal with those things?
Yeah, no, you're absolutely right. It is one of the big challenges of the job. When I was training, you never really got any kind of formal training about how to deal with that. I think you probably get more of that now, but you learn as you go along as a kind of apprenticeship, and you learn from your mentors around. But it is a big part of the job working with children, not just the trauma. I mean, children generally do well from trauma, and that's one of the joys of the job, in a way that their bones heal very well anyway, and you can get them back to doing things. But for example, we had the MEN arena bombing, which was was very harrowing for lots and lots of people, but the staff involved as well. We obviously took care of a lot of children from that. But it's the everyday things with children as well. I see a lot of children that live very difficult lives. A lot of issues around kind of safeguarding and things like that. And that can absolutely be distressing. You have to find ways of dealing with that. You have a good team around you. We talk about things. I think when any difficulties you have at work, you need to kind of reflect about things, talk about things, and kind of move forwards, really. And it goes back to what I think someone was saying before as well, about having a very supportive partner, as well as your colleagues. My husband is also an orthopedic surgeon, so he understands the job very well. But you do need to kind of offload things, and you need to, so I kind of compartmentalize my life quite a lot as well. I like to deal with things at work and try not to bring them home. I have a home life with 3 kids as well. I try not to have them crossing over too much, so I can try and be the best of both, really.
Yeah, well, and having 2 dogs, I'm sure, doesn't hinder.
Oh, obviously they're my favourite children. Yeah.
So for the past couple of years, you have also been the Associate Medical Director and Deputy Responsible Officer at Spire Healthcare, which we can see in the corner of your screen there. Obviously, for people who don't know, I think that's a private healthcare hospital.
Yep.
And company. I mean, are you balancing that still with your NHS work? What made you decide to go down that avenue?
Yeah, so my consultant job has always been, so I was appointed as if you like, part-time as a consultant. Initially, it was interesting. It was a job share. So there was a consultant who was retiring, and we shared our job for 2 years. So you can be appointed in different ways within the NHS, even as a surgeon. So, and you can train less than full-time as well, which I did do for a year because I had 2 of my children while I was training. So I've always been part-time as a surgeon. And then as you get older, your job changes as you go. Your journey is, you have to have new challenges along the way. And certainly when I'd been consultant for some time, I was looking for a new challenge. I'd done a bit of medical leadership within the NHS, and then I was approached by Spire, so a bit kind of serendipitous, really. And they asked me, would I take on this role? And initially, I thought, crikey, that looks like quite a big role, and the old imposter thing that we've talked about. And I was thinking, in my head, I kind of thought, well, I'm only going to take this on at this stage if I'm going to enjoy it, because I want to enjoy what I do, because it will take time away. So my time is precious. So I want to enjoy it. I want to be good at it. And, I was very mindful of the effect it would have on my family. And then I thought, should I actually be thinking any of these things? And then I decided no, and I just went for it. And it was great because it's really nice to take on a new challenge. Kind of, whatever stage in your career, there was always a new challenge that you can take on.
That's great. I think that's such an important message, actually, for everyone who's attending this evening. There are always new challenges.
Absolutely, yeah.
Possibilities. I mean, I suppose, is there a future for more private healthcare? I think it's obviously, the NHS, is facing, a significant set of challenges. I have to say, I feel the NHS is in pretty fantastic hands, looking at the people that we've been talking to this evening. But, do you feel, how do you feel that private healthcare can coexist with and supplement the NHS in the UK?
hoping we weren't going to get too political. I won't make it political. I mean, there has been collaboration between the independent sector and the NHS for a long time, actually. You know, there's a lot of patients out there with need, and the patients are patients and need taking care of. The NHS is going through a difficult time, and it will do for some time, actually. Nobody has the answer to that. If you do, please let Rishi or somebody know. But, you know, there are... Yes, please. You know, there's challenging times ahead. I don't know how that's all going to pan out, but the collaboration will have to continue. I think we need to be very open-minded about that, put the patients first. And, you know, the NHS is a very different place. I mean, in my career, it's changed, and it's changed hugely from when it first started. And we have to accept that and work towards making it the best it can be. But I don't know if it can be everything to everybody. So I'm not sure that answers the question. It's a very big topic, and it will affect everyone here on the call and everyone, you know, future generations. There will be a way, and it will get better. So
thank you. I think that's a really good and ultimately optimistic and positive note for us to move on. Thank you so much, and you know, obviously we'll have some questions at the end.
Sure.
So moving on to our final guest this evening, to Noor Al-Safar, and so she's the class of 2020, you know, that first COVID hit year, and she is actually still a medical student. So she's the fourth year studying medicine with European studies at the University of Manchester, and you know, it's great to drag you here from probably what I imagine is some pretty intense studies, Noor. So can you tell us a bit about your experience at Manchester High? Again, I think, you know, you were doing 4 A-levels actually as well, weren't you? Yeah, again, nice mix with the sciences and then German as well. Can you tell us about your experiences here at school?
Yeah, so I was at Manchester High through from year 7 all the way to the end of 6th form. So I think as Hurindi left, I joined Manchester High. Honestly, like, looking back, it was just the best time. Like, I think it just gave me a love of learning so much, and I think that's such an important part of medicine because there is so much learning to it. But you know, teachers were amazing, made me really invested in maybe too many subjects. So I think when I was picking my A-levels, that was a big challenge because I obviously knew that I was interested in the sciences and I wanted to do my biology, chemistry. I loved maths, so I did maths and further maths. And then I was like, oh, actually, I love German because I don't know if any students here know Mr. O'Brien, but I had the best German teacher. And it's one of those teachers that make you super passionate about the subject as well. So I was like, well, I can't not do an A-level in German. So I did German as well. A-levels obviously very tough, a big jump from GCSEs, but I still really enjoyed it, and I think I still had the time to, you know, engage in all the other opportunities that you can have at Manchester High. So doing things like, you know, MUN, mock trial, other things as well, being like house captain and things like that. But I think when it came to sort of second year, 6th form, and the summer before that, I was like, I really need to think now about what exactly I want to do. I think because of the range of subjects I had, I was obviously, it seemed more science focused, but I was thinking, you know, things like law as well, international relations, maybe even like German as well. I think Mr. O'Brien was really, he was really keen for a lot of people to pursue languages at uni. But I think when it came down to it, I think medicine was the way I wanted to go. And I think my work experience is what ultimately convinced me of that. So I can't say that I was one of those people that, you know, came out the womb like, I want to do medicine, I want to be a doctor, because I was never like that. And I think it actually took me quite a while to come to that decision. But I think when I made it in that summer, just before upper 6, like, it was a decision that I was quite sure of. So
can you tell us a bit more about that work experience, though, that was obviously so, you know, formative?
Yeah, so the process of arranging the work experience was very, very challenging. I was like frantically emailing like all these consultants and these doctors who are probably like, who is this college student that seems to be like clogging up our inboxes? And then I eventually managed to land some work experience at the Children's Hospital at Manchester Royal Infirmary. So I was actually in the pediatric orthopedic clinic, but this was like post-operatively. So yeah, I was with a surgeon, and honestly, he was telling me like, oh, he didn't actually like speaking to people that much. Like, you know, he prefers doing sort of the technical work, but when the children would come in to see him, he just had this like most amazing manner and like dealing with them and like he had a beard as well, and some of the kids would come and play with his beard. And I was like, it's so ironic to see someone who says like, you know, I don't actually like speaking to people, I don't really like engaging with people in that way, I much prefer like, you know, the technical work I do. But then to see like this like beautiful like rapport that he built with both the kids and their families, and I was like, it was really inspiring actually. And a lot of these kids were suffering with some very with some conditions that were very like life limiting, and obviously were having significant impact on their life. But still, like the way that he was reassuring the families, like, you know, this is obviously challenging, but the medical team will be there for you every step of the way, kind of thing. It was amazing. And I think just off the back of that, I was like, yeah, this is something I definitely want to do. Not necessarily orthopedic surgery, I don't think surgery is for me, but I was like, building that kind of relationship with people and their families is something I definitely want to do. Yeah.
That's great. That's, you know, really inspirational. And so that's obviously part of what one needs to apply for medicine. So the work experience. You know, one of the things that people also say is that the volunteering is really key. Were you able to do much volunteering? I know obviously, you know, some of your you know, your upper sixth was affected by COVID, but you'd already got most, you know, this done before your application before the pandemic hit. So can you tell us about volunteering or any paid work you were doing?
Yeah, so well, it was paid work, but I was doing work at a tutoring centre, so sort of teaching younger kids. And the thing is I think it's like a lot of people were saying before, like I think people have this idea in their head that I have to do something like medicine specific to include it on my application. But honestly, like you come to realize that skills from voluntary work you do or paid work even is very like transferable to medicine. So with tutoring kids, like it was all about sort of adapting my communication styles according to like the student that I had in front of me. There were certain kids who English wasn't necessarily their first language, so it's about sort of how could I make the accommodations to sort of suit their learning as well. There was one girl who had sort of like a brain deformity that had caused like learning disabilities, who sort of really struggled with grasping concepts. So I think I sort of had to be very innovative there with like how I was communicating things and how I was taking account of her needs. And all of this stuff I talked about in my personal statement. And I think, and it was picked up at interview as well, like you said, anything that you include in the personal statement, they'll like to delve a little bit deeper. But honestly, like I really am grateful to have done that work experience, volunteering, because I think it equipped me with a lot of the really vital communication skills that I still use today when I'm speaking to patients. But yeah, so I think my advice to anyone would be, even if something doesn't seem like it's explicitly medical, like don't undervalue how much of the soft skills are actually transferable to medicine, and how much like, you know, medical schools will appreciate that when you come to write about it in your personal statement. Things I also did, like a little bit of time in a care home as well, which was obviously completely different type of demographic. But again, you have to sort of adjust how you're communicating with them. So all like writing about that and talking about that, I think really helped me, maybe even just as much as the work experience, I would say. So yeah.
And that's great advice for anyone who's on the call who's thinking about applying. I suppose that, you know, the other important aspect is inevitably the admissions test. You know, and you will have done the UK CAT, as it's called then. Did you do the BMAT as well, or just
I did both. Yeah.
So can you tell us a little bit about about what you did to kind of to prepare for it? You know, extra revision that you were doing. You know, any sort of like tips and tricks. Because obviously, increasingly, you know, obviously the BMAT will be leaving us after this year. But you know, the UCAT, as it's called, ultimately is very often the kind of the make or break for lots of medical applications.
Yeah, so I think I always say to people thinking of applying to like medicine or dentistry, like that summer before your second year of sixth form is not a summer. It's a lot of sort of preparing for the UCAT. So I spent like the best part of my summer holiday preparing for it. Honestly, like I'd say even to this day, it was one of the hardest exams I've done. And just by nature of it being, I'm sure anyone here who's done it or has heard about it, it's just very time pressured. And I think it's not like your conventional exams at school that you sort of can revise for and kind of cram for, not that I'm advocating that. But it's something that you really have to like build the skills over time. So I spent about like 2-ish months preparing for that. Couldn't really go on holiday, and sort of making use of like online question banks. So I was a portal called Medify, which was really helpful in terms of me sort of getting to grips with the kind of questions I could expect. A few sort of books that I'd bought from Amazon as well, just getting advice as well from like peers as well who were older, who'd already done it. Yeah, and I sat it. To be honest, I think I am naturally quite an anxious person. So I was due to sit it in August, and then I got to my date and I was like, actually, I don't feel like I'm ready for it. And then I pushed it a little bit, and then I was like, oh, I still don't feel ready for it. And then I pushed it a little bit further. So it ended up that I did it at the beginning of September, which wasn't the best idea from me because the school term had kind of already started at that point. But you know, I think I did it at a point where I felt thoroughly prepared for it, and I was happy with the result I got. So I think off the back of that, I decided to sort of choose my options in the sense that more of them were UCAT options. There was only sort of one university that I was like, I really want to apply to. That's a BMAT university, and that's the reason that I sat the BMAT. But I think there is something to be said here about sort of being strategic in your applications as well, because it's like, if you know you've got a good UCAT score, then make advantage of that. Like, it would sort of be unwise to put one UCAT option and 3 BMAT options. I know obviously the BMAT's being phased out, but by a similar measure, like, you know, if your UCAT is unfortunately on the lower side for whatever reason, you know, how you feel on the day, things like that, then it's worth being strategic and sort of looking, you know, what universities maybe don't necessarily prioritize the UCAT as much, but they look at things more like, you know, your GCSE grades or your personal statement or your extracurriculars and things like that. Because I think the thing that needs to be said is that there's no such things like a good medical school in the same way. I don't know if this is a controversial statement from me, but like I feel like with other subjects there's a lot of weight put on the institution that you study at, whereas at the end of the day, like, everyone that goes through medicine will be a competent doctor, will be able to practice. So I think it's more about being sort of strategic and seeing, you know, based on my profile, where's most likely to accept me, rather than, oh, I really, really want to go here. Although it's nice if you can have a bit of both, I think.
Yes. Oh, I think that honestly, that is all such fantastic advice. So I hope people were taking notes or listening very, very carefully if they see medical applications in their near future. So can you tell us a bit about what it's been like at Manchester so far? Again, sort of conscious of time, and you know, Mrs. Norton's got some fantastic slides for us. But you know, what any kind of like highlights, lowlights of your time so far at the University of Manchester?
Yeah, so I've had a really, really great time at Manchester so far. I think it was a little bit challenging at first just because of, I think I was going into university during COVID and all the lectures were online and things like that. So that was a little bit challenging, the preclinical part. But honestly, I started clinical years so last year. So I'm in my last year. I'm in my 4th year now. But yeah, I've just had the best time because I think you kind of get to see the proper medicine when you're on clinical placement. Like, the things you get to see, like, you know, being in surgery for the first time, like assisting in surgery, speaking to patients that are like end of life as well, which obviously is very harrowing, but it's like, it's such a like beautiful thing that you wouldn't necessarily be able to get had you been doing anything else. But I think the best part about Manchester for me specifically is that they very much encourage sort of your extracurricular pursuits that are either related to medicine or beyond medicine. So I got very sort of involved with like trade unionism and the British Medical Association. So I sort of lead like the students division of the Students' National Conference that we have. But also as well got involved with sort of policies regarding like women and girls in Manchester. So I serve on a panel with some like incredible women. We have meetings with Andy Burnham, which is so weird, and I'm the youngest member of that panel, and it feels so strange to be there. And to be honest, I did say Manchester, but I think Manchester High has a lot of credit to be taken for that, because I think they really sort of encourage me, you know, obviously there's a certain path that you're going to take, but like, don't abandon the other parts of your personality that make you who you are. And I think as a result of that, I've been able to, you know, really like fully throw myself into clinical placement and enjoying that, but also the other sort of extracurricular pursuits that bring me a lot of joy as well.
Oh, that's fantastic. And one of those things, obviously, is the continued love of German, you know, which again goes back to Manchester High. And I think you done a placement over in Germany, have you? And that means you'll have this additional aspect to your final degree. And I think, you know, you're, as far as I'm aware, you might eventually go into sort of, you know, global healthcare, global, you know, policy. You know, just to finally, if you don't mind, sorry, Noor, if you could just tell us a bit about those aspects of your life and learning.
Yeah, so just like with regards to intercalation, that's sort of the area that I'm interested in going into. So I'm putting in an application to do a master's next year in global health and public policy, because I think this is probably inspired by doing MUN at school, but it made me really interested in sort of the wider policy surrounding healthcare and legislation. So I'm hoping to do that. But I think also, you know, the German really helps with that, because obviously language, it means that I'm sort of more open to practicing internationally as well. And so I would really love to maybe sort of relocate abroad, Germany or Switzerland, maybe, who knows. But I had a really great placement this summer. So as part of the European Studies program, we were like required to do a placement in a country that speaks the language. So I did it in Munich in pediatric cardiology, which is insanely niche and specialized. But yeah, and I think it was like an incredible moment for me, because I was like, I'm examining patients, taking histories, like interacting with colleagues in a language that I learn at school, like, you know, and I have, you know, Manchester High to credit for that. So yeah, but I'm really sort of looking forward to the future. I think I really would love to practice as a doctor for a bit. GP is on the cards. It wasn't before, but my last clinical placement might have converted me. But yeah, and then I think just in the longer term, like you said, doing sort of things related to global health and policy, maybe a bit of humanitarian medicine would be the dream. But we have to see sort of where life takes me and whether other placements change my mind.
Wow, oh, honestly, I mean, it's so, I have to say, it's so impressive, and you know, makes one feel very proud. You know, that so many of the threads that you've been you know, discussing, all of you really do go back to your time at Manchester High. You know, it's you know, wonderful. So we are you know, reaching the end of our kind of interview section really. If anybody does have any final questions, please put them in the chat. Somebody has discussed something about particularly the GP path. So for any of our guests, you know, for whom, you know, that's particularly relevant, can people sort of maybe talk about, you know, again, what the process is like these days to become a GP? You know, you join a clinic. I know these days often there's a lot of very multi-doctor clinics. You know, is it possible to set up your own clinic? You know, how does that work? People who've worked in general practice, particularly in the NHS. Have anybody who can...
I can talk to that. So
Oh,
so in general, when you've done your foundation training, you'll apply for your GP VTS, your vocational training scheme, and that's usually 3 years, not 3 months. And so you do 18 months usually in hospital and 6 monthly rotations in sort of obs and gynae, pediatrics, psychiatry, internal medicine, and then you'll do 18 months in general practice. You've got a really good run in actual, you know, jobbing as a jobbing GP. And then you've got such a huge variety of options after you've qualified as a GP. You could work in private practice, or you could do a bit of both. You could go into teaching. You could become a salaried GP or a partnered GP, which is you know, where you're kind of running a sort of a GP business. And I guess it all depends on sort of what your values or what's sort of important to you in terms of what you want to achieve in your career goals. So where I work at the moment, we're such a sort of an international hub. We get a lot of people traveling to Abu Dhabi, and, you know, I've treated celebrities, heads of states, but I tell you, any day of the week, I would take the chap from, you know, the Outer Emirates, whose dad was a Bedouin and he works in a camel farm, whatever. But that's where I feel I could add the most value based on the skills that I have. So I would say, you know, when you first start work, get experience in everything and everywhere as much as you can before you sort of hone in on what might be best for you.
Brilliant, thank you so much, Sarah. That's great. So we've got somebody else, and Ryan's asking, what is the difference between an NHS staff member who reaches a position of high leadership and those who are less comfortable with less responsibility? How can an individual make themselves more of an obvious candidate for those more you know, extended positions? You know, how would you recommend, you know, fulfilling ambitions within the NHS? Anybody? Anne, would you like to maybe speak to that?
Yeah, so I think I'm understanding this question correctly. I think so leadership, we all do leadership all the time, and I think a lot of the time people don't even realize they're doing it. And I think for the next generation, they will start honing their leadership skills a lot earlier and in a more kind of formal way than we certainly did. So it's never too early to start working on your leadership skills. And leadership can be anything from leading your team in theatre, which I do every day, to moving up the ranks, as it were, to leading bigger teams in different ways. So leadership will be part of your life regardless. There are some people who actually really kind of go down that direction. It really plays to their skill set and they make fabulous leaders, and we need great leaders. For people who, I mean, it is a choice though. Some people are not comfortable with that, and that's fine too. So you will find your way. There's lots of kind of courses and mentorship programs you can do around leadership. It will always be a really important part of medicine and surgery within the NHS and in the independent sector. So it depends on if that's your thing, but I think we could all benefit from some coaching around leadership skills.
That's great.
I don't know if that answers the question.
No, I think it really does. No, absolutely. I think that's absolutely. I mean, it's evident that yeah, you are like leading and being a member of a team from day one, which is there are so few careers I think where both of those are in evidence so much. So one question which I think we've sort of answered really, because lots of people have talked about their different work experience placements. But we've got a question from Mustaqim about what are the best work experience placements that you can do to boost your personal statement and to learn skills that you would use in medicine or maybe not in medicine. Again, I think probably does it matter so much exactly kind of what area of medicine you do work experience in, or frankly it doesn't really make much of a difference. No, I mean you're the most recent person who's perhaps you could discuss that.
I guess with regards to like medical setting specific work experience, like the bottom line is like the skills that doctors and surgeons have will be pretty unanimous across the board. I feel like, they have to have a certain degree of leadership, but also be able to work within a team, be able to sort of communicate, be able to work under pressure, things like that. I think you would observe like sort of any doctor demonstrate in their day-to-day work. So I think it doesn't really matter specifically what sort of department you're in, but I think with regards to just general work experience, I think it's more about being able to sort of, and I don't mean this in a bad way, but manipulate what you've done to suit the personal statement, because I think you can sort of take anything from any type of work experience or like volunteering or work. So for example, even if you work in hospitality or, as a cashier or whatever, like, you're able to work under pressure. There's times when people might not be responding very positively to you, and how you sort of counteract that, and how you deal with sort of very pressured environments. Like I think there has to be like there's a certain skill of sort of manipulating what you've done to sort of suit the soft skills that you would be expected to have in a medical profession. So I guess for anyone that's like worried that they don't have the right work experience, the right volunteering, like just use what you have, just be smart in sort of how you portray it in the personal statement, I would say.
Great. Thanks so much, Noel. I think that's excellent advice again. So again, I'm aware of time, and I know Mrs. Norton is ready to deliver some fantastically useful slides and talk about them. But again, we've perhaps particularly Harindi, could you talk about any? We're not quite there yet, Nina. Sorry. Okay, we're just going to respond to one more question, I think. So particularly in terms of interview, Harindi, could you maybe give any advice or tips for how to prepare for interview? Obviously, often schools and particularly Manchester High, I know, will be giving lots of support. But anything that you think you wish you had known or you did know and was advantageous during the interview process?
So I think, to be honest, with interviews, as a doctor, you go through multiple stages of interviews. So the first one you do is trying to get into med school. And to be honest, the best thing you can do is just practice. You don't have to practice with, a particularly formal situation. You don't have need to have a doctor interview you or anything, but just you have to be put in that situation where you're put on the spot, you get asked a question, and you need to know how to deal with the sort of the stress of the situation. In specifically to med school interviews, I would do your homework about what type of interviews your med schools sort of their layout of it. So I mean, I had one of my interviews at Birmingham was, I think, now fairly standard, but they were called multiple mini interviews or something like that. So instead of the traditional panel type interview, so you need to know what you're going to get asked in each, or at least the format of it. Prepare, do a bit of reading around things like, if it's as simple as some data interpretation, then I'm sure school will help you just trying to, get something. And just, it's how you interpret data, for example, but you just need to practice. You need to know what type of interview you're going to have, and then it's just all about practice. Get used to talking out loud. And the one thing that's also, I'd say, going forward generally in life for interviews, practice in a mirror. It's good to know what your normal sort of habits are, whether you move your hands around a lot, how you hold yourself, the way you're speaking, things like that. Once you know what you're doing, if you don't like it, you can correct it slightly, but it's just practice.
That's great. Thank you, Rindy. And thank you very much, Anne, for responding in the chat to one of the questions about some difficulties with the NHS. I am going to move over to Mrs. Norton. So she is both the head of Junior Sixth here at Manchester High, but also most pertinently for this evening, the head of careers. And she's going to be talking to us about the application to medical school. Thank you very much, Mrs. Norton.
Thank you. It's lovely to see you all. It's lovely to see Noor, who I do remember, who left not that long ago, and I do remember that year we called you the COVID kids. Sorry, but you're doing brilliantly, and I'm really, really proud. It sounds like you're having an amazing time. So I'm just going to talk to you. I've got a few slides about really the process of applying to study medicine. So, and I'll just say, Nina, when I sort of say next slide. Don't worry, I'm not going to go laboriously through this whole list. But essentially, when you want to study medicine, we've heard some amazing stories about people in their early part of their career still training, to, you know, the middle part of their careers, done some amazing things. But the thing that unites everybody is it's an extremely tough place to get to. It's really, really competitive. There is a 16% success rate in terms of conversion from applications to actual placements. That's the 2022 figure. And as the Guardian it said itself at the time, it's been the hardest year ever to get into medicine. So the reason I say that is it's worth noting that it's incredibly competitive. And as you'll have heard from our speakers tonight, they're extremely impressive. They're extremely hardworking, extremely dedicated, well-rounded, resilient, flexible, able to juggle lots of things, academically strong, and all of those things do have to be in place. Now, having said that it's a 16% success rate nationally, as a school here, you know, we have several examples right here in front of us. The students here are hardworking, are dedicated, you know, you're all academically high achieving and doing lots and lots of things in terms of extracurricular activities and volunteering and involvement and leadership and all of those things, all of which is really, really important. And so the success rate for our school here is much, much higher than the national average. The majority of our students get a place first time, and most certainly second time round, and it can often be a 2-year application cycle because it's so competitive. So the first thing, really, I'm going to go to kind of one of the end bullet points there, is stamina and resilience. If you want to do this, you have to be determined. You also have to be realistic, and I'll come on to that as well in a moment. But you do have to have stamina, and it is hard work. It's a long process. So what you're seeing now is the product of all of that hard work and dedication, and that's where you can all be if you want to, and if you work hard for it and you're determined. But it is a tough process, and there will be some challenges ahead, but school is really good at supporting you, and whatever school you're at, I'm sure your school will have things in place to support you. So just very quickly, undergraduate medicine is a 5 or a 6-year course. You can also do graduate medicine, which is you do an undergraduate degree in something else, and then you do it as a graduate degree, and that's usually about 4 years. For some universities and for some students, you can do a foundation course to get onto a medicine program. Typically, those foundation courses, though, are for what we would call widening participation students. So students who maybe have contextual factors which make their application a little bit tougher for them. So, but there are a few available, and you do have to look at those. And it's important, if you're not thinking that you're necessarily quite where you want to be academically at the point of applying, that might be something to look at. There's also the option to study abroad. Some students study abroad. Typically, they might go to Europe, and I'll talk a little bit about that later. There are also allied health courses. A few of our speakers have mentioned other people who work within the healthcare provision sector, and there are lots and lots of different things that you can do that I'm sure you're aware of. Things like pharmacy, pharmacology, physio, nursing degree, midwifery, physician's assistants, optometry. There are so many different types of allied health courses you can do, and you can go on and perhaps do graduate medicine after that, or you can go into the research aspect of things and be working in hospitals and with patients, but maybe not as a doctor. And that is something worth considering if you want to be in this profession, but you don't necessarily think that doctor is for you. So what do you need to actually start with? Well, you need to have really good GCSE results. You need to basically have 7s in your sciences, and you need to have 7 usually in English language GCSE. This is not absolute 100% everywhere, so please don't panic if that isn't you. But our speakers have mentioned, particularly Noor, who's most recently done it. You know, the application process, you've got to look at all the different aspects of all the different universities and what they're all asking for. Again, with the A-levels, absolutely you need chemistry. Mostly, I would say they all want biology and chemistry, and then something else, 1 or 2 others. 1 other is absolutely fine, and it can be anything from another science or STEM to something completely different, fine art. And there are different reasons why you might do those, and we've heard from our speakers why that might be, but please don't listen to other people when they say, well, you have to do maths. No, you don't have to do maths or physics or further maths. Yes, there are mathematical aspects that might be helpful, but history or a language is going to be equally helpful. So it's about you and what you are happy with, what you will thrive in and enjoy. And most importantly, because you do need to get a minimum of 3 A's in your A-levels, what you are going to get your best grade in your third subject. So I'm sort of adding a slight touch of kind of the nuts and bolts practical things here to help you put these wonderful careers in the context of how you're going to get there. The BMAT, as we've heard, is one of the entrance tests that about 8 universities used to use. It's now being phased out. So when all of you are applying, there won't be a BMAT. It's going to be the UCAT, the Clinical Aptitude Test. And Clinical Aptitude Test is a test which it's done under time conditions. You only get to do it once. It's not done in school. You go to a test centre, and it's very, very, very skills and aptitudes based. I'll talk a little bit about that later. Work experience. All of the universities want work experience of different kinds and voluntary work as well. It doesn't have to be that you've shadowed a brain surgeon. It doesn't have to be that you've worked every day in a hospital for 2 years. All of the things that the speaker said are true. Particularly what medical schools are looking for, though, is consistent, caring, empathetic communication type work. So that could be anything from paid work that we've heard about to the sort of voluntary work that's more typically that you might think of in a care home or something like that. Increasingly, those things are very hard to come by because of COVID and post-COVID strict rules in place. But there is always voluntary work that you can do, whether it's working with children in your local community, perhaps you're a member of a local religious organisation, and they sometimes might have in their places of worship things that you can do to help support people in that community. There are all sorts of charity shops that you can go and work in. There are all sorts of things. You just got to be tenacious in finding something that shows consistent empathy, communication. Stamina and resilience you need, and you also need to have good working knowledge of the NHS, and that's not to make it a political thing. It's simply you need to know exactly what the NHS is all about. There are lots of sort of background contextual ideas about the NHS, and you also need to know sort of current topics in the NHS. And one thing I didn't put on there just before we move on to the next slide is the interviews. All medical schools interview, and one of our speakers mentioned the MMI, the multiple mini interviews. Apart from Oxford and Cambridge, they all do that now. And we actually run a session in school, which those of you who are our students are in year 12, year 13. I don't know if any year 13s are here tonight we'll be hearing about, but it's a big sort of kind of speed dating for medics, basically. You go into these different stations, you're placed in scenarios, you're asked questions, you're given some data, you're given an article, you're asked about one thing you've learned on work experience, and you have a couple of minutes to answer those questions or perform. And it is quite demanding, but we do offer practice in that. And the majority of the medical schools do that process rather than the panel interview, the more traditional question and answer, which is what you would get at Oxford and Cambridge. So I appreciate this is a real whistle-stop tour. If I could have the next slide, please. Thank you. So the medic portal for any young person, whatever age you are, if you're moving towards thinking about this as a course of study and a career, the medic portal is a free website. It's a brilliant resource. There are lots of other ones out there, but this is sort of the best one in terms of collating everything together for students. There is a paid section, but you don't have to subscribe to the paid section. They have a whole raft of free information in there, and you can compare all the different entry requirements. You compare all the different 45 medical schools in the UK and type of learning that they offer, the application process, all of those things. There's a comparison tool in there. As you can see from that, they've got support with UCAT and interviews and all sorts of different things across the top there. You can see the menu. There are blogs, there are webinars, there's guides for things, there's how to prep for things. There is so much in there, and it's collated by somebody. The medic portal was started by a man who went to Cambridge to do medicine. He became a doctor, he became a practicing doctor, and what he realised is that a lot of people he came across felt like they wanted a bit more support. This was many years ago, with how to prepare to have become a doctor. They were really sort of finding that difficult, and he actually moved out of being a practicing doctor to setting this up. We've mentioned intercalation tonight, and intercalation is where you can take a year out of your medical studies and do something else. And I don't know if the man, Ben, who set this up, but I know somebody else who's helped us with the MMIs. He actually used his intercalation year to do a research project into medical school education, so how people learn at medical school, and he did a whole project on that. And so he set up a kind of an MMI support system for students applying to medical school, and that was his intercalated project. So that was a really sort of interesting and very useful thing to do. So the medic portal, go on there, it's free, it's brilliant. Next slide, please. Thank you. So Medical Schools Council is another one, and the Medical Schools Council is really good. The reason I put that there is because it is the Medical Schools Council, and it's going to have everything about medical schools, but it issues every year a big booklet that you can download as a PDF, read as a PDF, or you can just click it online, either way. And it has every single medical school in there in the UK, and it just has a comparison tool, and it really summarises every single facet of their application process. So dates and deadlines, what tests, GCSE requirements, A-level requirements, what they do in terms of contextual offers, the type of interview they might have, all of these kinds of things. And it's all there very neatly organised, so you can simply just go down and look through that, and as well as having lots of other things. And you can just see at the bottom there competition ratios and things like that, or all the different qualifications that you might get, how they look at the personal statement. So there are lots of different things, and that's really, really, really useful website. Next slide, please. So I've got a few slides next. Oh, so the UCAT, I'll talk about that. That's the test. The UCAT, it is a very challenging test. Essentially, you take it in the summer between year 12 and year 13. And the format is there. You probably can't read that. It's very small. I wouldn't expect you to necessarily read all of that. But it's very quick. There are the sections there that you can see. As you can see, verbal reasoning, decision-making, quantitative reasoning, abstract reasoning, situational judgment. It is not asking you really about science. It's not really asking you about the NHS. It's not asking you about your work experience. It's testing your innate aptitude, but you can study for it and you can practice for it, as Noor has said. And we do run something here in school for that for students, but it is, I have to say, it is the #1 indicator now of what medical schools will do with your application. Now that the BMAT is being phased out, this will be the one that is used, and it's the single unifying aspect of all applicants, which is why they use it, because it's the sort of levelling playing field for everybody. If you, for example, have access arrangements for your normal exams in school, you would have access arrangements to this. So, for example, extra time, then you would have extra time for this, and there's a process to apply for that. But it's very fast, it's online, it's very quick. You get your answer instantaneously, sorry, your result instantaneously, and so you know how you've done. It's quite stark. It can be quite stark and quite stressful, as Noor has said. She obviously did very well in it, as did everybody who took it. But that's something that you need to bear in mind. If you are somebody that doesn't like stressful test situations, this maybe isn't for you. But again, you can practice. There is so much practice out there. Next slide, please. So I've got a couple of universities. I'm not going to go through all the details through all of them because it will take too long, but this is Birmingham Universities. Birmingham University has around a 30% success rate of applicants. Sorry, my light has just gone off because it's on a timer. I'm just going to wave my pen, sorry. Sorry, it's part and parcel of the eco office. So it has a very complex, every medical school has a complex way that it judges your application. And so in a nutshell, what Birmingham does is it looks at your GCSE results and takes that as 45% of the judgment it makes. It takes your UCAT score and uses that for 40% of the judgment that it makes about you. And it will take any contextual information that you might have about yourself to do with perhaps postcode or anything that maybe makes you a widening participation student. So family income, first person in the family to go to university, adverse circumstances, things like that. And if there's any of that, that counts as 15% of your application. And they've got a very complicated calculator system. Every GCSE has a point score attached to it. They average them out. It's very complicated. All of the universities do this, and so you do need to be strategic. So if you're somebody who's got fantastic GCSE results, all 8s and 9s, you're probably going to want to apply to a university that it looks very heavily at your GCSE results. So again, it's a lot of research that needs to go into this, because looking at that national statistics, 16%, you've got to be really, really strategic in where you apply. Next slide, please. Thank you. So this is Imperial College London, and our students have success at many of the places they apply. They have success at Imperial. Now, Imperial was doing the BMAT, and it's no longer doing the BMAT, and it used the BMAT as the #1 decider, and after that it treated every aspect holistically. And so if you did really well at the BMAT and you got to an interview there, it looked at all aspects more or less equally. I should say that the entry requirements for Imperial are A star, AA to 3 A's, depending on, there are some factors that they take into account there. And again, Birmingham is A star and 2 A's. Thank you. If you could just do next slide, please. Thank you. Glasgow. So Scottish universities. Scottish universities are really, really popular. Again, you can actually find out from all of these universities. If you just Google it, you can find out the success rates of all of these universities in terms of application ratio. It's not an exact science, but it gives you a general idea. Glasgow University is really, really popular. It has about a 30% success rate, and so Scottish students don't pay for their degrees. If you're an English student, Welsh student, Northern Irish student, and you want to go to Glasgow, you do pay the fees. There is no kind of bias for or against Scottish or non-Scottish students. But it's just worth knowing that Scottish students don't pay fees and UK students do. International students now pay fees where they didn't, because after Brexit, European Union students now have to pay fees there. So the one thing I would say about Scottish universities is that they tend to leave it very, very late to tell you whether or not you've got an interview. They tend to be quite late to tell you that, and can be quite stressful. Thank you. Next slide, please. So Leicester University. Now, Leicester University has a higher success rate. It's 40% success rate. And Leicester University, this slide is actually with the foundation year. Now, most foundation years apply to students, as I've mentioned, with various circumstances that maybe may make their life more challenging. However, this is one of the universities that has a foundation year that is open to all students, but if you probably can't read the small print there, but essentially there are 35 places on this course with the foundation year that gets you straight into medicine, and 25% of those places are for people from the Eastern Midlands, which sadly we are not, and 10 will be from anyone, anywhere, with no widening participation flag. So you can begin to see how competitive these are, but it's worth knowing that they are out there. Next slide, please. If you want to study in Europe, so some of our students want to study in Europe, and there are lots of different ways that you can do that. I've put up from the Medic Portal's website, the European medical course is taught in English. So if you study medicine elsewhere and you want to come and work in the UK, there is basically an exam that you have to take. If you're a non-native speaker of English, which I expect all of you are here tonight, then there's an English language test you need to take as well. But presuming that you go there speaking English and you do an English speaking course, if you come back here and you've been trained as a medic there, for example, you will need to do a test. But that's, plenty of people do. And there are lots of reasons why it's a really fun thing to do. I mean, we've heard many of our speakers tonight have been abroad and worked abroad in different places, or might be going abroad to work in different places. So it all adds to the wonderful sort of tapestry of the training and of the profession. And we have every year we have one student, at least one, who does that. So we've got a student this year who's actually doing dentistry in Valencia in Spain. But these are quite popular ones in Eastern Europe. They have slightly lower entry requirements. They don't require a UCAT. The application date is a little bit more flexible than the UK ones. So that's very, very much an attractive option for some of our students, for some UK students. And there's a little website there called the Medical Doorway, and they're a bit like the Medic Portal. It's a free website where they give you loads of advice about applying to study medicine in Europe. Next slide, please. Okay, so penultimate slide, graduate medicine. Some students choose to apply for medicine as a graduate program. And it might be because they feel they're not ready to do the undergraduate degree. Perhaps their A-levels aren't quite the grades they wanted to be. Perhaps they've not been so successful on the UCAT. Perhaps they didn't know they wanted to be a medic initially. So these are all the graduate programs in medicine in the UK, and it does actually tell you what the requirements are and whether or not you need a science degree to get onto that program as a graduate. So you can see, for example, that if you want to go to Cardiff to do graduate medicine, do they accept non-science? Yeah, if you want to go to Cambridge, sorry, it doesn't matter if you've done a science degree, but for some of them you can see in there that you do have to have done science. But it's really nice to know that you could. I taught a student a few years ago who had done English literature at university as an undergraduate and decided she wanted to be a doctor because she'd done some volunteer work in her degree at Durham, where she was helping a crisis centre at night, helping students in crisis just on the phone lines. And she found it so rewarding, and she thought, gosh, this is my calling. And she finished her literature degree and then applied for graduate medicine and is now a doctor and absolutely loves it, which I think is fascinating. So I'm an English teacher, there's hope for me yet. So that's just an option that people might want to do as well. And then just final slide from me, please. Thank you. Okay, so medicine apprenticeships. The doctors amongst you will probably be smiling. So there's this thing apparently called a medicine apprenticeship, which is apparently out there and going to happen. I do hope it does. Apprenticeships are fantastic. They're available in so many different areas. There are so many apprenticeship degrees in so many different areas that you can do. And one of the ways that it's being talked about as a possible route into becoming a medical practitioner is by doing an apprenticeship. And as we know, an apprenticeship is where you learn on the job practically, but that you also get your academic learning and training at the same time. And these typically take a little bit longer than a normal degree because you're doing the practical and the academic at the same time. Thing with the medicine apprenticeship degree is I think there's a lot of support. I think people want it to happen. I think people think it's a good idea. It's just how, in a practical sense, do you put that into place? Because the thing about a medicine degree is it's already got a practical aspect to it, the work experience. You're already learning there on the job. So there aren't really that many more places available in hospitals and clinics to support more students coming in. So whilst I've put that up there as kind of how far have we got in this process, because the idea is out there, it's something that's being talked about, it's possibly coming down the line, but we're not sure when. So if you hear about medicine apprenticeships, you can read a lot about them, but there aren't any that I'm aware of yet actually happening. But I wanted to put that there because I think that is something, and depending on the age of some of our listeners, it may be that comes into being by the time you get to the point of applying. So just to round up from me, sorry, I realise I've been speaking really quickly, and also I've been giving some quite sort of hard-hitting facts. I think that it's not to put you off, but it's just to make you aware that actually this is a very challenging thing to do. You know if it's right for you, you know if you want to do it. If it feels like something that you can do and that you're really determined to do, you should follow that. You should work as hard as you can in your subjects, whatever stage you're at now. You should do the kinds of things extracurricularly, volunteering, work experience, leadership, anything that you think plays to your strengths and then enhances your skill set. So if you think, actually, I haven't really had a lot of teamwork, I've not really led a project. Now, leading a project doesn't mean you need to open, a big sort of neuroscience clinic in Manchester. It just means you've got a team of people where you're perhaps doing a presentation for your lesson, and you perhaps do the design of it and say to the class, your group, right, can I lead, or I'll lead on this, or they vote you to lead on it, and you can write about that in your personal statement. So it's really about doing the things that are your strengths, doing the things that you love, doing the things you're going to succeed at, and making sure, as I think Noor said, that you sort of turn those into successes and positive attributes and positive examples when you come to your application, personal statement, interview, and so on. Because what they're looking for is a breadth of skill and personality type and competence and a very high academic standard. So that is all from me. I shall finish there, bit of a whistle stop, but any of that information that I've told you, I'm sure it can be made available to you. If you look at those websites I mentioned, it's all up there. So thank you very much. Happy to talk to anyone from our school about this if you want to come talk to me about it some other time, possibly not now, it's nearly 8 o'clock. Yes, certainly. If I've missed anything desperately out there, obvious, perhaps Mr. Crumpton can add it in at the end, or anybody else. But other than that, thank you very much to our speakers. It's very, very impressive after what I'm sure has been an extremely long day for you all. So thank you.
Thank you so much, Mrs. Norton. I have to say, whistle stop tour, but incredibly comprehensive and delivered, with such energy as well. So thank you. And again, I really reiterate Mrs. Norton's thanks to all 5 of our guests this evening, to Zehra, to Harindi, to Mamuna, to Anne, and to Noor. Again, thank you so much for giving of your time. I hope everybody who's joined the Zoom this evening has enjoyed it as well. It will be available. The recording will be available subsequently on, I think, on the website. And yeah, obviously. It's honestly such a privilege and a pleasure to listen to all of your stories, your experiences, the advice and guidance, and I feel genuinely better informed and really quite hopeful about the future of medicine and the NHS. So thank you all very, very much. An amazing panel, as somebody's just said on the chat, and I hope it's been useful for everybody who is thinking about medicine as a career. So and we will leave it there. Thank you all so much. And yes, if you do have a question, please email development@mhsg.manchester.sch.uk. Again, thank you so much, everybody who's been on the panel. Really inspirational. Thank you.
Thanks. Good night, guys.
Thank you. Bye.
Thanks. Bye.
Thanks.
Bye.